Welcome to The Milk, the podcast that pours it all out, the messy, the magical, and the mildly unhinged moments of motherhood and womanhood. Real talk, honest stories, and reminders that none of us really know exactly what we're doing, and that's kind of the best part. I'm Tayla, your host and soon-to-be mom of 3, so let's laugh, learn, and milk this season of life for all that it's worth. Hi everyone, welcome back to another week on The Milk. Today's guest, we have Dr. Paul Nassif. He is a world-renowned facial plastic surgeon, the founder of Nassif MD. He's a father of 5, and probably most of you have seen him as a star on Botched, which was on E! Dr. Nassif, thanks for joining us today.
Well, it's great to actually, I love doing this. First of all, how did you get the name The Milk?
The Milk? Okay, so...
Is it because of a pregnancy
You know
thing,
how,
or?
yeah, so you know how like the young people say like, give me the tea, like spill the tea, like give me the details on something?
Spill the milk.
So milk, motherhood, babies, kids, that's kind of where it all stemmed from. So it's like the milk on motherhood and beyond.
I love that.
Yeah, well, thank you.
Great name.
Thank
Great
you.
name.
Well, Dr. Nassif literally came out of surgery this morning and welcomed us into his home, so thank you for that.
My pleasure.
I'm so excited for this conversation. I've been looking forward to it for months since we kind of decided to do this because it's on a topic that so many moms feel, but I feel like we don't often talk about it, where our bodies go through so much internally and externally through pregnancy and postpartum. And we just want to feel even an ounce of normalcy and feeling just good in our skin again. And I want to say most of our listeners are on the younger side, kind of new moms. So I don't want to focus on like the big mommy makeovers and all of those things. I really want to focus on the skin and the face and kind of what happens through pregnancy and postpartum and just ways that us moms can feel rejuvenated and refreshed and just kind of get rid of those tired mom eyes that I'm constantly putting concealer on from lack of sleep. So to kick us off, I'm genuinely so interested. Like, how did you get into plastic surgery? Like, where did that passion stem from?
Absolutely. By the way, before we even say that, so I empathize because, I have a young wife.
Yeah. And
she's a brand new mom. Actually, we have a 5-year-old and now a 1-year-old. And of course, that little boy is waking up, I don't know how many times a night, even still now. So I'm exhausted also. And so you're right. I can empathize with the changes, especially externally, besides physically being tired, but externally what happens when you have a baby. I mean, that's a lot of stress on the body. It really is. And so I can see that. And so, that's why, my wife we're looking at always, okay, what's the best skincare to help her skin get brighter and tighter again? Even though there's some minimally invasive procedures, things, or surgical if you need it, especially when it comes to the lower part of the body or the breast area for women. Mm-hmm. But it's difficult.
Yeah.
So men are very lucky. I'm going to say that. I've always wanted to be a doctor, and I started probably, I don't know, maybe 11, 12 years old. My uncle was a general MD, and that's when it all started when I was really young. And of course, my mom kept saying, my son, I want him to be a doctor. And actually, I got to tell you, when the mother does that kind of thing to a young kid, say, why don't you be a doctor? Maybe it did actually have some influence on me. And then I'm originally trained as an otolaryngologist, which means I'm an ear, nose, and throat doctor. And 20% of our training is facial plastic surgery because we're with the face. We know all the anatomy very well. And then I went and did a fellowship because I fell in love with, the anatomy of the face and making patients feel good, not dealing with a lot of cancer surgery, things like that. So what we do is whether it's reconstruction, like you see me on Botched do, or a beautiful facelift. It's fun surgery, so we look at it as fun. Mm-hmm. So we're doing, for example, this morning, my fellow Victor is sitting right off here. We just did a 5th surgery on someone's nose, and very complicated, but for us it was routine. But it's fun. We enjoy it. We enjoy a great facelift, And so that's how I got into this. One, I'm making patients feel good. We are changing their lives, especially with the reconstruction. And it's hard surgery, but it challenges us all the time.
You're a problem solver.
And it's we're constantly figuring out what can we do better. And even though I've been doing this for 27 years or so, we're still looking at how can I make the next surgery better, whether it's on the nose or the face. We're constantly discussing this.
Yeah. Okay, so I want to get into that because you are most well known for very challenging reconstructive surgeries. That's what you did on Botched. So I'm so curious, was there a specific case that has stood out to you the most where you had the most challenging yet rewarding procedure done that really changed a patient's life?
So yes, I'm going to just call out two.
Yeah.
Maybe season 3 or 4, we had a woman named Lucy de Prima. I remember her name really perfectly. She came in, and this was revision rhinoplasty. Remember, we do a lot of first-time facelifts, deep plane facelifts and gliding lip lifts and brow lifts, all these great surgeries. But with this lady, and Botch is more focused on the younger crowd, and it's whether it's something with the face, but this was the nose. So she had something which we were suspicious for fluid leaking out of her nose, and we thought it was coming maybe from her brain. So I said, I think you need to get a CT scan, just to, because she had trauma, ran into a wall in Italy on a moped, and that's what started this whole thing with nasal reconstruction. So she ended up having a few aneurysms in her brain. And with these aneurysms, depending on the size, they could actually hemorrhage, cause a stroke, and death. So, and there's even some family histories in my side of these things, so you have to monitor them, in our family. So she ended up having a bunch of those, and it got diagnosed. Then one of them was big enough where she actually had to have it treated. So basically, it saved her life. The doctor said this thing probably was big enough now that it could actually, burst anytime. So we ended up saving her life, came back for her rhinoplasty, and that was something where you literally save someone's life, She had an autistic daughter also, where she felt like she couldn't go out a lot because of the way her nose looked. So she did not do a lot of things with her autistic daughter. And so when we finished the whole thing and did her nose, and she was really happy, she brought her daughter, over. And it was, where I actually met with the daughter, and her daughter said, "You brought my mother back to me." But she was, severely affected with autism. And I cried on the show right in front of everyone, I've cried actually a bunch of times on the show.
I'm sure it's hard not to.
And the other guy hasn't, but I have, because I'm sensitive. Because you have young kids, I became very sensitive after that.
And bringing someone's confidence back.
Yeah,
and
it really changed her.
Yeah, you can tell there's such a difference probably in the before and after process of the person that walks in your office to the person that walks out.
Well, the interesting thing was her before and after was good, but compared to the way it affected her life, it shouldn't affect her life that bad. She wouldn't even take her to the park.
Yeah.
So, and it was horrible. For that, I see she could not, because she was paralyzed, only wanted to stay at home and couldn't do things with her daughter. The other one was on our last season, our last episode, a lady from Mexico who had a tumor growing from her face literally about a foot down.
I saw this on your social media.
And that was, we transformed her life. Now she's got a job, she had a boyfriend, everything changed.
That's
because
incredible.
Imagine growing up having a tumor, thinking you're a monster. So, those were two of them. We helped so many people.
Yeah.
Every episode had really something, a special story. But when you could actually change a person's life with something that we can do pretty, hopefully the word routine, it makes you feel good. So we've helped a lot of people in my career.
I love how you take a holistic approach where you also are so inclusive of skincare products
Yes.
to treatments and then to procedures when those
Yes.
don't kind of suffice. And I'm sure, assuming that you probably have a lot of women and young, new, but also older moms walk into your office, and it's probably a very vulnerable experience for them because they are looking to feel a little bit more like themselves.
Yes.
How do you approach that conversation with them in like a delicate way where you want to help them, but you also don't want to say yes to all of these extremes that they might be asking for while just grasping for something?
Well, with my personality, I'm very direct.
Yeah.
I mean, that's, again, you see it on the show. And so I have to say most young mothers that come in want a little something to make themselves feel good. It could be as simple as a hydrofacial. We have, by the way, one of the hydrational boosters. And by the way, hydration is one of the main things for young mothers for their skin. It's called the hydroglucan. It's one of the boosters that the machine hydrofacial does. And that's like it actually opens up your pores but delivers, infuses different boosters or peptides into your skin. Something simple like that. Or, and I discuss with them, so, what are you looking for? Most of the time they're not saying, please, I need surgery everywhere. They're not saying that. What can I do to look better, feel better? I mean, there's things that we talk about called soft wave, which is a little, gentle ultrasound to help tighten the skin in the belly, for example. Or after a while, they may need surgery, like a breast, lift, things like that. And the most important thing for the patients really is, what can we do? What can we do? Is it a simple laser that we can do, or is it just skincare? And the difference with surgery and skincare, the reason why I did this is because we needed to hydrate and get patients' skin ready before surgery. Mm-hmm. Whether we want to add vitamin C, whether we want to add hyaluronic acid, the best thing is to prep their skin. Because when I'm doing a deep plane facelift, if the skin does not look good, the results don't look that good.
Interesting.
I can do an incredible facelift, but if the skin doesn't look great, it's just not going to be a wow.
Yeah.
Does that make sense?
100%.
It's a synergistic effect between the two. So when it comes to, young mothers, basically what we're going to do is we're going to have the esthetician meet them and look at their skin. Whether it's pigmentation issues, whether it's melasma, whether it's just dehydrated, thirsty skin, which most of the time it is. And that's where this product is, the HydroScreen.
Yes. Okay. So
it does have retinol in it, but you can still use this and you can still breastfeed.
So one of the reasons why I reached out to you is because Scotty got gifted, I think is it the wash with the scrub, where it has like a scrubbing effect, the cleanser?
That's one of them, yes.
And I stole it and I tried it, and my skin has never felt so amazing after it. I'm like, I want this for myself. And so I just tried your products and I fell in love with them. And I love that your step one is kind of like skincare, even though you're a world-renowned plastic surgeon, like you care so much about starting with the skin. And so there are moms out there probably listening too that are like, I'm not interested in procedures.
Yeah.
Maybe I'm interested in a couple lasers or a peel, but
absolutely,
what can we do? What products, yours, but also what ingredients are the best for moms, pregnant, postpartum, that really help with hydration, help with hyperpigmentation, fine lines, and dark circles, just like brightening our skin?
Absolutely. So even if you're breastfeeding, again, there's all types of skin products that you can use, especially, depending on what type of, for example, retinol. It depends on what type it is. This one is bound to hyaluronic acid. And we do say, pregnant women can use this. And what that does, it hydrates it. It gives you volume in your skin, helps pop out the wrinkles. Very important to give you more volume in your face, especially the lower eyelid area. We want volume. And so that is an incredible one to use. And there's something called ceramides in that. Mm-hmm. And the ceramides lock in the hydration. So hyaluronic acid is like a little small baby balloon going in your skin. and then it expands like a big water balloon. Or taking your skin looking from a raisin to a grape.
Ooh.
That is a good way to think about that. The detox pads, another great one that, women that are pregnant or just had a baby can use. These pads do about 12 different things to your skin. And it is, especially after the shower or when you get home at night, is absolutely incredible to use.
Like a refresh, right?
It's a refresh. It's exfoliating, cleansing, helping clean out the pores and they shrink, texture, radiance, skin tone, hydration, does everything. And then especially for brightening the skin, we have a 10% vitamin C. And that vitamin C, for example, is great. Or niacinamide. We have a new niacinamide with 300 biopeptides. Great for brightening the skin, giving that skin that pop that you need because you feel that it's dull. Mm-hmm. I mean, you can even go detox pads, the vitamin C or the niacinamide, whatever works better with your skin, and hydroscreen. I mean, just like what we're showing. So these kind of 3 items right here. And then if you really need that hydration and you want to lock in moisture, it's that skin barrier protection cream right there. That is something that is a beautiful, luxurious cream, but it hydrates absolutely incredible.
I feel like, especially pregnant, the baby just sucks all the moisture out of my body and my face. And
That's
I think
right.
so many moms, like, I just feel dull. I feel dehydrated. I feel kind of puffy and hollow. And just like, I never have this like bright skin. So I'm excited to try
These
that one
will
out.
help.
That sounds amazing.
Now, what I always have to do for the medical disclaimer,
Yeah.
I feel these you can use when you're pregnant, okay? But you still would want to look at, okay, all retinol, then if that's the case, you're not using the hydroscreen. I mean, I'm saying of what not to use, whether it's your OBGYN or you do your research of what you feel you don't want to use on your skin during the pregnancy stage.
Yeah. And every pregnancy and pregnant mom, all are different and have different needs. And if there's like a high risk pregnancy versus a low risk and whatnot. So I always love to run anything past my doctor before using, even if I'm confident in using it myself, just in case, to get different perspectives. One thing I'm so interested to hear your perspective on is I feel like almost every single mom suffers from melasma through pregnancy. I can't escape it. Every pregnancy, I'll try to hide from the sun. I put sunscreen on and it still comes up. Do you have any hacks? Like, how do you tackle melasma? Let's say once you're done with your pregnancy.
Once you're done.
Yeah.
Yeah, because during the time when you do have melasma, it's the sun and good sunscreen. That's what you got to treat it during that time. Because those melanocytes that make the pigment are working overtime. And I will tell a patient when they come in initially from skincare aspects, besides what I told you, hydrate, do those things. And to me, the vitamin C 10% alternating later on with the niacinamide with 300 biopeptides, those 2 would be the ones.
So it's just skincare products.
Well, that's the start of it for
Okay.
brighter skin. The number one thing that we do, but it is a procedure, it's called nanofat. So we take fat from the belly and we process it down to get the cells out of the fat, multipotent stromal cells. And we inject them or use a little micro roller, like a dermabrasion micro roller, over the area we have the melasma. The goal with those is those cells we feel hopefully kind of slow down or turn off the melanocytes, the ones that like making pigment. And it might take a year. So that's another procedure, but it is a little surgical procedure per se. And the other is lasers. There's different lasers that help decrease and treatments that are more medical grade to decrease that. And a good esthetician is going to get you on a routine or a derm if you need it to help slow down and cut off the melasma. And by the way, it takes time. It's not a quick fix.
Yeah.
But you can control it.
That's good. And I have noticed a difference when I use a good vitamin C, especially right after giving birth. A lot of my melasma just naturally disappears.
It does.
But then there's the stubborn bits that I've only done like a vitamin C serum, and then I've done a little bit of microneedling. Not that it's that great, but it does break things up and help build the collagen,
Sure.
and it helps. Are there specific lasers that you highly recommend for hyperpigmentation or melasma?
Two things real quick. There's a peel I have called the Radiance Resurfacing Peel. It's a vitamin C peel with alpha beta hydroxy acid activator. That twice a week will help it. In regards to the lasers, some of the pigment lasers, again, I'm not, my nurse practitioner does those, but I do know, if I'm not mistaken, what is it? Is it the halo laser? We have a halo laser. It's good for pigmentation. Now remember, some folks, though, have deep pigmentation in the lower eyelids. And I have to tell you, that's the only time that I've seen improvement, because nothing I feel works for that is with the nanofat.
Okay.
Again, injecting those cells into the skin.
Okay. Well, I want to get into these lasers or different types of treatments a little bit more. I thought it would be fun to play like a little game where we're going to call it, just to see which ones you think are worth the hype or some that are just overrated. Your answers can just be worth it, overhyped, or depends.
Okay.
How do you feel about Botox?
We all love it. It's worth the hype.
Okay.
I mean, I'm a Botox guy. I mean, I've been getting Botox for many years.
What about preventative Botox?
In the beginning, I was not into it. I think if someone comes in with absolutely no wrinkles at all, I'm going to say no. If someone comes in with no wrinkles, but is constantly frowning or raising the eyebrows or squinting, I'm going to say yes for preventative.
Okay.
So there has to be a reason.
Yeah.
So worth the hype, worth the reason.
Love that. So it depends.
Depends.
Great.
Okay. Better answer.
Filler.
You got me on this one. Let me tell you why. I mean, we do filler in our office. And I think when you're younger, if you want a little volume, if you need it, it's depends. But now what we're seeing in surgery when we're doing these deep plane facelifts, just like last week. Woman had filler here years before. We did the facelift. It was coming out of the deep plane.
It migrates,
So
right?
it migrated. And can it cause a little bit of scar? Now, if it's just migrating, and then when we make our little cut and start lifting up what we call the deep plane, and if it just comes out, no big deal. Okay, it migrates. But we're not sure yet if it's causing scar formation, because usually patients have had radiofrequency or microneedling or with radiofrequency or ultrasound that goes deep, and that does cause scar tissue. Mm-hmm. Could even melt fat. So I'm going to say filler depends.
Okay.
With that long answer I just gave you.
No, that's good. What about this new trend of salmon sperm facials?
I've heard about it. I don't know. I mean, I don't think it's worth the hype. I mean, do you know anything about that? I mean, I hear it's expensive, and, does salmon sperm really do something to your skin? By the way, I'm talking to Dr. Shu, who's my fellow, who's sitting off the right. So I don't think it's worth the hype. You know anything about it?
Yeah, I mean, I know it's super popular right now. I feel like there was a big wave, especially in Korea.
Okay, is this a Korean thing?
Yes.
Started as a Korean
I know
thing.
people flying to Korea to get these salmon sperm facials at a discounted price because it's so expensive here.
I agree with Dr. Nassif. I think for salmon sperm, I'm not as bought into it. I feel like
I'd rather have the nanofat.
Okay.
Yeah, I'm not seeing as big of a change.
So not worth the hype. Good to
No,
know.
not worth the hype.
You're going to save me some money. What about PRP?
So I've been using PRP for over 25 years in surgery. I still use it. However, we're now looking into what PRF, a company, is bringing me some. It's a little bit heavier duty, a little stronger, and we're injecting different platelet products now into the skin, even as a filler. That's not, which is the one that we're using at the office now? Is it PRF?
PRF is the one we're using at the office.
And that's why now we're injecting the lower eyelids. We're injecting it because we're seeing if that is your own, it's from a blood product, to see if it doesn't cause scar and to see if it kind of stimulates your own body to start doing things. So for injections into the face, PRP, not worth the hype. It really doesn't work. I do use it in surgery for the deeper planes. PRF, we're learning still, but we think that could be promising. We do use PRP, though, for injection into the scalp. It is worth the hype for hair growth. We will do some microneedling with PRP, still worth the hype. So I'm giving you different levels, basically.
So for certain things, it's worth the
Certain
hype.
things.
Certain things, not really. Okay, let's dive into some of the lasers, if you know of them,
If I know them.
or just like what you've heard from other doctors that use it. Is it the Morpheus?
So the negative thing about radio frequency with microneedling, because, I used to love doing it in our office. But one, we're seeing that it can dissolve some fat. Two, Morpheus, especially when we're doing a deep plane facelift, we're seeing a lot of scar. It makes the surgical planes harder to distinguish, which means that if you are going to have a facelift sometime in the future, I'm going to say not worth the hype because of that risk of causing problems in the future.
It's interesting because it gives you some benefits, but then there's also some downsides later on to certain things that you get done.
And those are the downsides we're seeing.
Yeah. What about CO2 lasers?
So CO2 lasers, or we like more of a YAG profractional. A lot of my doctor friends still love CO2. We like profractional.
Is that the same as Fraxel?
Fraxel is a type,
Okay.
and it's a little bit kinder, gentler. You might need a few more, but I'd rather see a profractional, something that doesn't have you down for a month. Mm-hmm. Or you could have one pass with the CO2, which is not going to be it's not going to cause that much downtime.
As deep.
So I'm going to say worth the hype and depends.
Okay. What about IPLs? Less invasive.
Yeah, IPLs, BBLs, intense pulse light, broadband light, blood vessels, brown spots, all those things, maybe a little texture change, we like.
Is it more
Worth the hype.
temporary? Is it more temporary, or where you have to do them more often than like longer lasting?
I think you usually need a set of 3 or 4 of them.
Yeah. Okay.
And I think then if you damage your skin more, then you're going to come back in a year or 2 and need more.
See, that's the issue. It's like once you do them, you have to stay out of the sun. You have to wear big hats, make sure you're on your skincare. Otherwise, it comes back.
Yeah. I mean, yeah, but you can always, every 6 months, you can always do, another one if you need to.
Yeah. Okay. So for the moms that feel like they just constantly look tired under their eyes, dark circles, where you feel like you are just always plopping on that concealer, what do you recommend for under eye hollowing and just brightening, I guess?
Well, besides fat grafting, that's the surgical point.
I want to get into that soon.
For us, when it comes to hydration, we have a periorbital complex, which uses a product called Vin Uplift. That is from grapes frozen on the vine in Switzerland, harvested a few times a decade. That right there has been shown to increase hydration, and it makes the lower eyelid look beautiful. That followed by the Hydra Screen. Those are for the skincare aspect of it. And again, for the lasers, and that vitamin C peel I was talking about. But for lasers, again, it depends on one of these halo lasers. What can it do for pigmentation? And again, depending on the depth of it. So that's what I'm going to say. Mm-hmm. The lasers, anything that's actually going to goes after the darker spots or brown spots or red spots.
Yeah. I want to get into this face grafting.
Fat
grafting. Okay.
Hopefully I
Because-
said fat grafting.
No, you did.
Microstructural fat grafting.
So this is a trend I'm seeing more and more where people are going away from under eye filler and they're looking at fat grafting for
Yes.
just kind of helping with
Hollow.
hollowing.
Yes.
How do you feel about that?
And by the way, there's risks of blindness with filler into the lower eyelids. With fat grafting, which I love, like this week we're doing 2 facelifts and lip lifts and brow lifts and fat grafting and nanofat. And we'll look at the face and say, where do we need all that fat? So I love it. I'm going to say the average is about 50% of the fat stays. And you just use what we call a blunt cannula, little pop here and here, and you can actually use fat. And expect on the average, with the good injector, about 50% of the fat staying.
Okay, so you can just take it out of, where do you take it out of?
You take it out of your belly or your thighs or inside your medial knees.
And what's the downtime on something like that?
You might be swollen for a day or 2.
Oh, wow. So it's not too invasive.
No.
Okay.
I mean, we love fat grafting. I'd rather do fat grafting than having anyone put filler in their face.
Yeah. No, I feel like it's safer and probably lasts longer. What about skin laxity? What do you recommend for that? Is it, obviously some skincare can help, but maybe are there any treatments that you recommend?
So the Soft Wave, based out of, I think, in this area, San Clemente or San Juan. Again, that gentle radio frequency, it's a gentle ultrasound. That helps. It has FDA, approved. It's got 2 components. It's got, for the face, other parts of the body for skin tightening, FDA approved. Something gentle for gentle laxity. Mm-hmm. But it also has a pure tone, I think it's called. They have a new modality, and again, it stimulates like jump squats, that type of an exercise. And now they're showing studies that it really helps with the abdominal muscles, helps with your butt, helps with your thighs, your quads. So it's a stimulation, electrical stimulation, pure impact. But in the way they set up, you can walk around with these things on for an hour. And it stimulates the different areas. And I think there's at least 6 or 8 areas that while you're getting some laxity taken care of, you can stimulate those muscles.
Mm-hmm. To build strength.
Plyometric.
Okay.
It's imitating and mimicking plyometric exercise. And so I really like it. Maybe even, if you think about it, it can actually work in different areas. Maybe it can even work over here for tightening up that skin. So the Moxie laser for texture. Again, I like that laser. And then again, the Profractional for wrinkles, for colors, the halo. And they have a BBL again for the reds and browns.
Okay. So for a mom who is trying to limit budget, what are 1 or 2 not procedures. What are 1 or 2 treatments? They could be minimally invasive. They can be more than that you would die on a hill recommend, saying they work the very best. It's the best bang for your buck.
If you need a small change, Soft Wave is very effective. To always add skincare. I'm thinking of another one that, nothing for sure really works. In other words, you can't guarantee. So I can't guarantee when you say, well, the big bang for your buck, I'm thinking for a minimally invasive procedure, all those lasers for the skin I mentioned are good. But for tightening, lifting, firming, because remember, I told you I'm now kind of getting away from all that because of the scar we're seeing. I'm thinking if there's something that I really, really fell in love with. You have an idea?
I think RF microneedling, if done correctly.
So you're a fan of that. Now, of the body, a radio frequency microneedling device might be great. I still think there's new technology going to be coming that is going to be fantastic for skin to minimally invasive skin tightening. We have the J Plasma Renuvion machine, which if you're doing lipo, I was just talking to a doctor about this the other day. He does a lot of lipo, following up if that skin's a little bit loose. Inside that area where they've done the lipo, he passes a radio frequency with helium cannula, which helps tighten up the skin, called Renuvion. That, especially even in the neck, if we're doing a little liposuction and you want to tighten up the neck, even though it does cause some scarring. But of the body, I think Renuvion is absolutely fantastic to use.
Never heard of it.
But it is a surgical procedure, whether it's a little lipo, whether it's adding Renuvion. Oh yeah, it's been around maybe for 6-7 years, I think. But that might be the biggest bang for the buck if it's performed by an experienced surgeon who has a lot of expertise.
Yeah.
Depending on what area you want to get treated.
Okay, well let's get into procedures a little bit. We haven't really spoken too much about that. I love the treatments. I'm all about the treatments. I haven't really gone to procedures yet. But I'm just like interested. I feel like it's nice to hear about these things for the future of when I'll probably need it more. At what point does it make sense to move on from just skincare and treatments to procedures?
It depends on if the findings, let's say an upper eyelid lift, which I'll do that sometimes in women in their 30s. With the small incision across the upper eyelid, you're removing some skin. Not removing brow skin, it will pull the eyebrow down. That's going to be the first procedure. So when you got that extra skin hanging down, you can try my periorbital eye cream, and it will give you a little bit of a nice lift. But if you want to just get something permanently, an upper eyelid lift, that can start, let's say, in the mid to late 30s even.
Is that different than an upper
genetics.
Is that different than an upper bleph?
That's an upper bleph.
It is. Okay. I want to get your perspective on upper and lower blephs, because that is another trend that I feel like I see everywhere. But then I've also seen some horror stories where they've done lower blephs, and then when and then they smile and it just like brings everything, it's too tight that it's going up. I saw this girl crying on TikTok saying that she regretted it so much, but I've also seen some that look incredible. What's your take on upper and lower blephs?
Well, with the upper bleph, sometimes it's not really the eyes, it's really the eyebrow. So we do something called a gliding brow lift with the hemostatic net. By the way, they can get you a photo with the net and what it looks like right after. And what that is, that's a skin lift. It's not the typical, it's not the typical endoscopic where we're using instruments to lift up the eyebrow. It's making a small incision either here or here, lifting up the skin and putting the muscle and everything left behind. Okay? And that can elevate this for us beautifully with the hemostatic net on for 2-3 days. Hemostatic net is stitches placed outside the skin for 2-3 days, whether it's a lip lift, a face lift, a brow lift. So looks pretty scary. And she can get, again, we have photos of that he can even, he can get you, which show this weird stitches going through your skin. It looks weird.
Mm-hmm. Is that's different than threads?
Threads are underneath, and threads.
No.
Don't waste your money. So this is just something to hold up the skin from the outside while you're healing for 3 days. So upper bleph, absolutely. Gliding brow lift with the small incision, absolutely. Lower eyelid fat repositioning. You come in and you got these big fat pockets. We go from inside the eye, we take the fat and we move it down to the hollow area. We don't excise it, we remove it that way. And we reposition the fat to prevent hollowness. If you take out the fat, then you're going to get hollow and older looking. Now, skin removal in the lower eyelids, I still don't do it. A lot of my friends will do a gentle skin pinch, but we see people all the time that are like this. We just saw one last week, 2 of them like that. So you have to be very careful.
Yeah.
And if you take too much skin from your upper eyelid, you might not be able to close your eye, and we've seen that also.
Oh my gosh, terrifying. What about, I want to talk about the snatched look around the
neck.
chin, the jaw, and then the neck.
Yeah.
Where I feel like with pregnancy and then losing any weight, or, as we get older, you just see a little more looseness.
Yeah.
What do you recommend? Like, is it a micro lipo or laser?
No, not at all. Okay, first of all, by the way, for young mothers, an upper rib left, can be great. Okay, just a little bit of skin, 3-4 millimeters. And we just did that for a young mother last week, as a matter of fact. And, but when it comes to laxity in the neck, that soft wave I would try and see after 3 months if it helps. I'm not 100% sure to help with that. But the more invasive treatments of the neck versus surgery, I'm not a fan of those. Because I don't want to see skin and scar between what we call the skin and the platysma muscle. The muscle that, is this. Mm-hmm. You can get Botox in that. So the soft wave is not going to hurt you. However, I'm afraid of other treatments. I'd rather have you say, you come in, you've had 3 kids, you're done, you got a little looseness. Go ahead and try my DecoLift skincare and go try the small procedure soft wave. In regards to doing a platysmoplasty, where you make an incision here, maybe a little lipo, maybe the most conservative removal of fat selectively. Tighten the muscle here. I'm okay with that, even late 30s, early 40s. Early 40s, that incision to tighten the muscle here and a small short scar neck lift. A little incision back here, depending on if we have to go down here, depending on how much skin there is. And maybe we bring it just to the front of the earlobe. That, absolutely do that all the time.
And at what age does that you typically do that?
It could be in the early 40s.
Okay.
Then a short scar, little jaw, lower and neck. Do the same thing behind the ear, but you have to bring that incision up in front of the ear somewhere. Mm-hmm. And you can get the jawline here only with the neck. And that's going to be maybe, again, depending on genetics and how good the skin is. Remember, no smoking. That's a big no-no. Mid-40s. And then you might be someone who has horrible elasticity of the skin. Then it's a full deep plane face and neck lift. When the incision starts around the ear, hidden in front of the ear beautifully, back, down this way, and one here. And that's doing it. Now, when we go from that, if we're doing a full facelift, and you want that snatched look. So let's say you have someone maybe who might be younger, but has a neck that's obtuse. In other words, it's like straight down, almost to their, clavicle, their sternum here. And the anatomy does not look great at all. Usually there's something called submandibular glands. They're right here. And if those glands have dropped below the angle of the jawline, if we go in there and reduce them, remove 2/3 of it, and do some other what we call a deep neck lift, then you get that snatched look. And again, there's always risk with everything.
Yeah.
And we do the hemostatic net with that too. But that's going to give you the most dramatic results.
Yeah.
For submandibular gland removal.
What about for women in their 30s who are not looking for neck facelifts or anything? Is there anything that they can do just for more of like the definition look besides filler? Is it just filler or?
No, you could use a little Botox. You can use skincare because Botox can do certain things to make your jawline better.
Okay.
Soften the Botox in certain areas. And that's where, again, I'm going to say that soft wave. The reason why I keep saying going back to soft wave is because I even had it done after my, for keeping up tightness in the skin. But for a younger person, to me, this is the only thing that is not going to cause any damage to the skin.
Yeah.
Or if it does, it shouldn't cause any damage to the skin.
Yeah.
That's what I'm going to tell a 30-year-old, be mellow. This is something you can do. It does cost maybe $2,500 to $3,000, but that's something I would recommend.
Okay. You don't have to give us your secrets. You can also plead the fifth here. But what treatments or procedures have you done that you trust for yourself?
Oh, I've had a lot. I mean, my upper eyes done. I've had a little lower face and neck lift. I've had my nose done a bunch of times. Little fat grafting.
Ooh.
been years. And of course, I get Botox. I have gentle, mild Botox, so I have a lot of movement still. But I need probably another month and a half. It's a little bit more Botox. I'll get hydrofacials once in a while. Trying to think what other procedures, cosmetic-wise.
And just your skincare. I feel like you're probably
I'm on skincare all day long.
Yeah.
All day long.
That's
That's enough surgery. I had a lot, as you can see.
Yeah, but you also look very natural. And
Thank you.
I feel like that is also something that women look for in their doctors.
Absolutely.
Because there's so many doctors that say yes to doing all these different procedures and treatments on them, and it really bites them in the butt later on. So I want to end on asking you, how do you encourage women to approach treatments and procedures in a healthy way that just supports confidence, but doesn't make them feel like their value and self-worth lies in it?
Sure. It's the way the consultation goes and the way you talk to them. And, you start small. And the thing for the confidence and stuff and not overdoing it with the patients is, you again, it's really who the doctor is or who the provider is, how they approach the young mother. And make sure they listen. And then get them on something gentle. And follow up with them and don't, blow them off per se. And make them feel good. And hey, you're doing something for yourself. And that's the goal with all this, I think being knowledgeable, but not being pushy.
Yeah. And just little changes to just
Yes, little changes.
make
Very
them
good
really
point.
feel good and
Yes.
confident in their skin, not feeling like the only way they can feel that way is through getting all of these procedures. And the more they do, the more confidence they'll get. Because there's a lot of people who are like, I wish I never did all of these things
Yes.
and I kept it more simple. So if anything, I hope women listen to this episode today and just feel like there are ways, little to big, starting just with skincare or different minor treatments that can help them feel really confident and good in their skin after having kids, because we all deserve that. We've gone through so much with our bodies.
Yes.
We deserve to feel a sense of normalcy again. And so I appreciate you taking the time to sit down with us.
Well, it was great. I mean, thank you for having me on. I mean, listen, it's great to talk about. I have to say, most of the time we do these, it's usually the older crowd. So it's nice to talk to moms,
I love
so
that.
I'm here, and anything for you and your family. I love your family.
Thank you. And for anyone listening that could be local in California, you have offices in Beverly Hills and Newport, right?
Newport, yes.
And you can buy your skincare products online.
NassifMDskincare.com.
And your Instagram?
Dr. Dr. Paul Nassif.
You guys, Dr. Nassif is so good on social media. You have to follow. He gives so many great, just like medical advice and befores and afters. And I went through and I was stalking your page and showing Scotty all of these things. And I saw a bunch of your Botched clips of the before and after. And that's where I saw that tumor one. But he gives such a wealth of knowledge on his page. So definitely give him a follow.
Well, thank you.
And I
thank
might
you,
ask your
thank
team
you.
if there's any way we can get a discount code for any listeners on your products.
Oh.
If we can, I will put it in the show notes
Talk
for
to
anyone.
Alice, and I'm sure she'll dial you in.
Yeah. Well, thanks again. This was so
Well,
great.
thank you. And when do you due?
We have hopefully like 6.5 more weeks. I'm 33 weeks. So like mid-April, we'll see. And I'll be coming straight into your office for some like little skincare.
After you're done. There we
Yeah.
go.
Once I'm done, I need to get this melasma
Yeah, actually, you
off.
could actually even film it there.
Oh my gosh, we
We'll
should
get
do
you all
that.
dialed in. You can do some facials and all kinds
We'll
of stuff.
do like a follow-up
Yeah.
consultation.
You can do a
And
little baby
I love that.
young mother again makeover.
Yes, now that I'm done.
Number 3.
Now that I'm done having kids,
There we go.
hopefully.
Thank you, darling.
Thanks everyone for listening. Until next week.